The National Health Insurance Authority was enacted by Parliament in 2021 with a key objective to ensure the attainment of universal health coverage in the Gambia. For the first time in the history of the country's health sector, the initiative will be marked as the most important act enacted by Parliament in ensuring quality and affordable healthcare delivery. To ensure the full and effective implementation of the scheme, the Ministry of Health will partners converge for a day-long validation of the communication strategy and implementation plan to execute the scheme. Deputizing for the Chief Executive Officer, Asan Jai launched an appeal for joint collaboration of stakeholders towards effective implementation of the strategic plan to make healthcare services more accessible.
Universal health coverage actually is a beacon of hope for everyone because it aspires to ensure that everyone have access to needed health services without facing financial hardship. This global agenda embodies the belief that all individuals and communities, regardless of their socioeconomic status, deserve access to health services that they need. The Gambian National Health Insurance Act, which was enacted into law in 2021, represents a significant stride towards the goal of universal health coverage.
The Director of Health Services, Dr. Mustafa Bite, who is also the chairman of the authority, commended partners for their commitment since the project's launch, but challenged stakeholders to brainstorm on a workable communication strategy for a robust implementation that will stand the test of time.
As a ministry, our aim and the aim of the government is just to ensure that every person in this country have access to very quality health care without economic hardship. So we don't want you to travel very long distances to get this. We don't want you to pay too much money if you go to the facility to get this quality care. And we think that the answer to that is actually to have a national health insurance scheme or service in this country. And I can tell you that a lot of background work has been done. To reach this level where you even have an act, it was a Herculean task. And so I really want to thank all the people who contributed to ensure that we reach this level. But you cannot emphasize it enough that we need to get it right. That's why this communication is very important, and we need to make sure that we are very frank, we are very critical, so the document that we get out will be able to answer these questions, because we need to have it right the first time. We will not have a second opportunity.
During the day-long convergence, stakeholders will extensively and critically devise ways to map a vision for effective implementation of the health scheme. Bawa Silla, GRTS.